Welcome to D&M, a guide to epilepsy.
Hi, I'm Dr. Hayley Miller and this is my colleague Dr. Hannah Doherty. Today I will be discussing the types, classification and cause of epilepsy. My colleague Hannah will then discuss treatment of the brain disorder. Epilepsy is a serious neurological disorder that affects 1% of the global population.
That is to say, it affects approximately 70 million people worldwide. That is roughly 3 times Australia's population. This brain disorder is characterised by abnormal periods of electrical activity. This is caused by the misfiring of electrical impulses along and between neurons within the brain. This abnormal electrical activity is what we refer to as a seizure.
There are many different types of seizures depending on the location of electrical activity and the effect that it has on the body. Partial seizures are the result of abnormal electrical activity occurring in only one lobe of the brain. Partial seizures can be further classified as complex or simple. Complex seizures are those during which the abnormal electrical activity is present in only one part of the brain and consciousness is affected. A seizure during which consciousness is not affected and abnormal electrical activity is present in only one section of the brain is referred to as a simple seizure. Simple seizures can evolve into a generalised seizure. A generalised seizure is one in which the abnormal electrical activity occurs throughout the entire brain. There are multiple types of seizures that fall into the generalised category. The most common type of seizure is the tonic-clonic seizure, which was previously known as a grand mal seizure. They are characterised by the sudden tensing of muscles followed by the jerking of the entire body or a single limb. The most common type of seizure in children and adolescents is the absence seizure, that was previously referred to as petit mal. An individual who is experiencing an absence seizure will appear to be in a daydreaming state. However, unlike normal daydreaming, they will not remember anything about the time during which the seizure occurs. Nocturnal seizures are those that occur during sleep. They generally mimic a tonic-clonic seizure, and the individual often has no memory of the seizure when they wake shortly afterwards. They often experience headaches and fatigue. A tonic seizure is characterised by the sudden tension in the body. A clonic seizure is characterised by the jerking and spasming of the limbs or the entire body. Atonic seizures are commonly referred to as drop attacks. They are called drop attacks because of the sudden relaxation of the muscles, resulting in the individual dropping or falling to the ground. A myoclonic seizure most commonly occurs shortly after the individual wakes up and are characterised by the powerful spasming of the entire body or a single limb. There is no clear universal way in which epilepsy is classified. In an attempt to combine the various classification systems that have been proposed, doctors often base their diagnosis on the age of onset coupled with the type of seizure that the individual experiences. For example, a child who experiences a myoclonic seizure would be classified as juvenile myoclonic. The International League Against Epilepsy promotes 2 different methods for the classification of epilepsy. One system that they endorse is based on the seizure type, while the other method of classification promoted by the International League Against Epilepsy is based on the cause of epilepsy onset. The terminology that they use has changed over the years in an attempt to limit the confusion that resulted from the vague definitions of the terms. Older terminology such as idiopathic, cryptogenic and symptomatic have been replaced with genetic, structural metabolic and unknown. A third classification system based on causality has been proposed by Sheffer that encompasses 6 categories: genetic, structural, metabolic, immune, infectious and unknown. The genetic category would include all cases in which the individual's epilepsy has been largely influenced by various genetic factors, including heredity and genetic defects. Any detectable sign of abnormality or alteration of the structure of the brain that may be the cause of epilepsy onset would fall into the structural category. Metabolic causes refer to alterations of the body's biochemistry. The cause of onset of an epilepsy case that shows signs of inflammation of the central nervous system due to an autoimmune disease can can be classified as immune. The infectious category would include cases that are caused as a result of infection from various diseases such as HIV and tuberculosis. It is important to note that the epilepsy itself is not infectious. Cases where the cause is not able to be stipulated, but the location of electrical activity can be determined, for example frontal lobe epilepsy, are grouped in the unknown category. Now to my colleague Dr. Hannah Doherty.
Thank you, Hayley. So treatment of epilepsy is essential to help gain control to either reduce or eliminate seizures occurring. Treatment begins by prescribing the patient with medication. This medication is called an anti-epileptic drug. As discussed earlier by my colleague, there are many different seizure types, and diagnosing a patient with the correct seizure type is very important when it comes to treatment. This is because some anti-epileptic drugs are more effective than other anti-epileptic drugs at treating different types of seizures. If one anti-epileptic drug is not effective at treating the seizures, then a second or a third or more anti-epileptic drugs can be added to the patient's treatment regime. Getting the right combination of anti-epileptic drugs can be a long and complex process for both the patient and the doctor, as some medications are not tolerated well by patients. However, approximately 70% of patients do become seizure-free after the treatment of anti-epileptic drugs. Unfortunately, this does mean that 30% of patients will be resistant to this type of treatment. A number of non-pharmacological options that ought to be considered after drug treatment has failed to control the seizures. As you can see here, this is the flow of treatment options. So once drug treatment has been tried and drug resistance has been identified, these are your non-pharmacological options. They include brain surgery, neurostimulation, dietary therapies, and alternative therapies. The first non-pharmacological option is surgery. Brain surgery is the resection, destruction, or disconnection of epileptic brain tissue. So when the affected area of the brain tissue or the area in the brain where the epileptic seizures were taking place has been removed, there is either the elimination or at least the reduction in the number of seizures occurring in the patient. And now over to my colleague, Dr. Andrew Bleasel, who is head of the Epilepsy Unit at Westmead in Sydney. He will briefly explain who qualifies as an eligible candidate for brain surgery for epilepsy.
Those patients are patients where the seizures are coming from one spot in the brain, and that spot could be removed by a surgeon. This requires a detailed investigation. There's a series of investigations that take place over some months, usually in a specialist centre.
Thank you, Dr. Bleasel. So, brain surgery is not a viable option for everyone. However, when it can be performed, brain surgery results in the elimination or at least a significant reduction in the seizures for approximately 50% of patients. So, however, if brain surgery is not a viable option, then neurostimulation should be considered. There are two types of neurostimulation. They are vagus nerve stimulation and deep brain stimulation. Vagus nerve stimulation works by sending small pulses of electrical energy to the brain via the vagus nerve. These pulses are made by a device that is implanted in the patient's chest, and it acts rather like a pacemaker. It sends pulses of electrical activity at regular intervals throughout the day. So the device connects to the vagus nerve, which passes through the neck and up to the brainstem, which is at the back of the brain. So it sends the signal up to the brainstem, and the brainstem then passes the signal into other certain areas of the brain. So once the signal is sent to other areas of the brain, it aims to kind of block abnormal electrical activity in the brain, therefore preventing or reducing seizures that are occurring. So the second type of neurostimulation is deep brain stimulation. This is where electrodes are placed inside the cranium on the affected area where these seizures are taking place. And a neurostimulator is placed in the chest and connected to the electrodes in the brain by a lead. And impulses are sent to the electrodes to try and prevent seizures from occurring. It's not exactly known the mechanism behind why deep brain stimulation works, however it does work for some patients. Another type of treatment is using dietary therapies. Dietary therapies are used around the world to help treat epilepsy. The ketogenic diet is one of the oldest and most effective therapies for epilepsy. So the ketogenic diet is very high in fat and very low in carbohydrate and moderate in protein. It is a very restrictive diet and needs to be closely monitored by a doctor or a dietitian. The diet promotes the production of an amino acid called glutamine. Although the mechanism behind the diet is not fully understood yet, it is believed that glutamine does have an anti-epileptic effect on the brain, and therefore it reduces seizures. Finally, there are some alternatives to treatment that can be used to reduce seizures. These treatments include Chinese traditional medicines, yoga, meditation, acupuncture, cannabinoids, which are derived from cannabis plants, and music therapy. So these alternative therapies may help to reduce stress levels, which is important in those whose seizures are triggered by stress. So these alternative therapies can have a huge impact on a person's quality of life. More research does need to be done on exactly how some of these therapies have an effect on the brain. So looking to the future, there is little doubt that a greater understanding of the underlying brain structure involved in different epilepsy seizure types will hopefully lead to better treatment options.
We hope you have learnt a lot, and we encourage you to get involved and help raise awareness about epilepsy during the month of November, which is Epilepsy Awareness Month.
Thank you for tuning in this week to D&M's Guide to Epilepsy.
Make sure you tune in next week for D&M's Guide to Narcolepsy.
See ya!